Hi, my name is Arthur Budnick, and I am a volunteer for the Minuteman Senior Services SHINE program. And we're going to be doing a presentation for you on open enrollment for this season, 2020, with changes you make being effective in 2021. So I'm going to share a presentation with you right now, and we can start to look at this and discuss and talk about this a bit. So the first thing is SHINE itself. And I mentioned I'm with the Minuteman Senior Services SHINE program. I'm a volunteer for them. But we fall under the governance of the Executive Office of Elder Affairs of the state. And we are a SHIP program, which is federal. So we fall under the ACL jurisdiction also. So we have a number of different bodies which help in our governance, basically. But the thing to point out to you is SHINE itself, we don't sell insurance. We do not charge for our services. We are a free service. And we strive to give you accurate and unbiased information about Medicare itself and all the private plans that interact with it in our county and our vicinity. So that's basically who we are. If you want to get in contact with us, you can call Minuteman Senior Services. You can call your local council on aging, or you can call 1-800-AGE-INFO and press 3, and that gets you to SHINE. So let's dig into things and see what's going on. First of all, we're in open enrollment. It began October 15th and extends through December 7th. Anything you change then becomes effective for January 1st in the upcoming year, 2021. There's a separate Medicare Advantage enrollment which allows you to correct mistakes, in a sense, that you may have made during your open enrollment period. For example, if you picked a plan and your doctor isn't covered in the plan and you want to make a change in January through March 31st, you can switch Medicare Advantage plans. It's more restrictive in what you can do. But keep in mind the third bullet here. If you're in a particular plan right now, and your health is stable and you received your annual notice of change and things are stable with the plan and you're happy with it, you don't have to do anything. You do not have to make a change. But when you receive your annual notice of change and or if your plan you feel and sense is radically changing for you or your health is radically changing, then it's a good thing to examine your current state. There are many Medicare Advantage plans out there. Your SHINE counselor can help you look into these. And also you can go to Medicare.gov and look at things also. Just a note here, some federal employees must have Medicare A and B in conjunction with their retirement benefits. If you are such an employee, then what we're discussing here will have some relevance to you. There are things happening in Medicare that sometimes are important to you. If you are getting your insurance through the Health Connector, that assumes you're not 65 yet. So if you're aging into your senior years and you're 64 and you will be turning 65, please note when you turn 65, you should talk with the connector and or talk with your council on aging and get in touch with the SHINE counselor. Because if you are eligible for premium-free Medicare Part A, if you are eligible for that entitlement, you cannot remain on the connector. It will have bad consequences for you if you do. Now, mymedicare.gov is an account you can open on the Medicare website. Let's visit that while we're doing this. And if you are on the Medicare website, you're going to see a couple of things that can be of importance to you. You can look for drug plans and Medicare Advantage plans, and you can compare and contrast them and with the set of drugs that you're taking. So you can see how it would more likely affect you. You can do that more easily and get more information in an easy fashion, and it will retain your information if you create a Medicare account, if you create a mymedicare.gov account. So we suggest you do that. So that's what, and there's a wealth of knowledge on Medicare. You can find information about all aspects of Medicare there. So it's worth looking into. We're not doing a Medicare 101 here. We're not here to explain Medicare. You are already experienced recipients, and this is just to let you know what's changing in Medicare land and the surrounding plans. And here we're just doing a little quick recap as a reminder. So Medicare Part A, you know, is your hospital insurance. And the operative issue there is if you're admitted to a hospital as an inpatient, then that's what your status is, and you're covered by Medicare Part A. And there are deductibles associated with this. And so there are costs that can come with being, with entering a hospital as an inpatient. And be aware of that, and we'll be discussing that a little more. But the status and the operative issue here is that you need to be admitted as an inpatient to the hospital, not just physically be in the hospital. Medicare Part B covers you for your general medical expenses. If you're visiting your doctor and you have a cold, you have poison ivy, you have a sprain, and you go to the doctors, it's Medicare Part B, which is providing your physician services. It also provides your emergency room services, and you're covered under those rules there. Oh. So Medicare Part B is your general medical expenses. It's not premium free. And for this current year, 2020, the monthly premium for the average recipient is $144.60. Depending upon your income level and your status with Medicare, you might pay something that is different than that. But for the most part, it's that amount. Part D is your Medicare prescription drug coverage. Now, with your Medicare prescription drug coverage, that works when a physician writes a script for you, a prescription to be filled either through mail order at your local pharmacy. These are standalone private plans that can work in conjunction with A and B. And it's something that changes from time to time. So if you do need to review it, and we'll get into that. Part C of Medicare is a little different. These are Medicare Advantage plans. So Part C are also known as Medicare Advantage plans. Again, they're private plans. Medicare approves of them and contracts with them to provide for that season your coverage for A, B, and if you choose to get them, drugs. So it's kind of like a wraparound umbrella. You take a Medicare Advantage plan and it gives you your coverage at the hospital for physicians and for the prescription drugs you want to utilize if you choose to take them. There are networks involved with this. So you can't just go anywhere you want. It has to be generally within the network of that Medicare Advantage plan. And we'll see more about that. So here, I'm just reiterating and making clear the types of things you do during open enrollment. One is you may want to change your prescription drug plan if you are utilizing original Medicare and you're taking this path. So if you're taking this path, you have Medicare Part A and B covering you, and you can add drug coverage to it. And that would be a standalone prescription drug plan. And during open enrollment, you can change that plan if you're not happy with it and you want to do something else. You may also add in something referred to as a supplement or a Medigap plan. Those two names are synonymous for each other. A Medigap is a supplement. And their purpose in life is to pick up the costs that Medicare approves of but doesn't cover under A and B. An example might be the hefty deductible that exists for Part A. Another example might be under Part B, approved Medicare service charges fit under the 80-20 rule. Medicare pays 80%, you pay 20%. If you don't want to pay that 20%, you would get a Medigap and it would sweep up and clean up and take that 20% and deal with those charges. We'll get into this a little more closely and deeply. Another path you can take, which we had just mentioned, and this is the same outline, is a Medicare Advantage plan. You always have to keep your A and B current in order to have a Medicare Advantage plan. So you are paying the $144.60 or whatever your monthly premium is. You may switch and swap around Medicare Advantage plans during open enrollment. So if you're in a plan and it's changing and you don't like the way it's changing, you can pick a new plan. And we're going to get into some of the things you can do in the next slide. In the earlier slides that we were looking at, we were seeing an overview of Medicare Open Enrollment and the parts of Medicare and how they interact and what you might consider doing during open enrollment to swap something around and change it. Well, here we're going to take a closer look at the different private plan concepts that are out there for Medicare and take a closer look at what you should consider and how you might approach making changes during open enrollment. The first thing we're going to look at is Medicare supplements. And as mentioned before, supplements are there to pick up those costs or gaps in coverage that Medicare normally doesn't cover for you. We mentioned quickly there's a hefty deductible for Part A, and it's possible to pay that more than one time per season. You can pay it several times depending upon how often you go in and out of the hospital and what your timing's like. That amount was $1,408 for this current year. Next year, we don't know what it is. And Part B, which is your medical insurance coverage, and that follows the 80-20 rule. And Medicare pays for 80% of approved Medicare services, and you normally pick up the 20%. That can be all well and good, but if you have chronic conditions and if you are seeing many physicians and getting many types of tests, CAT scans, MRIs, etc., that Part B can get more expensive. You can pay a lot of co-insurance on that. And if you're also in and out of the hospital, and depending upon your timing of when that happens, that can become expensive for you. That's when you may want to consider getting a Medigap plan, which is also a supplement, also known as a supplement. Those two names are synonymous. So if you're looking at getting one, these are some of the characteristics of supplements over here on the right-hand side of the screen. The first thing to consider is supplements are approved at a high level, the concept's approved of by Medicare, but they're governed and more closely defined within each state. And the Division of Insurance of Massachusetts governs our supplements that we have, our Medigaps. And a couple of points around that is you need to have Medicare A and B to have a supplement. One of them is not sufficient, both A and B, then you can get a supplement. It can be used anywhere Medicare is accepted. There are no networks to speak, there are no networks for them. So you can use it anywhere in the United States where Medicare is accepted. And that's a good thing. If you spend some of your time in the summer in Maine, some of your time out in the far west in Arizona or something, colder weather, and some of your time in Massachusetts, you have a chronic condition, you can utilize Medicare doctors and facilities in any of those three locations, and the supplement will work to help support you and pick up those gaps in coverage. And those gaps in coverage is this next bullet notes copays, coinsurance, deductibles, and things of that nature. What else do we have? We'll take a look further on. We'll look at these more closely in the next slide, but there are 3 products in Massachusetts, and we'll take a closer look at what they are and how they interact. They do things slightly differently in what they cover. And also here, continuous open enrollment in Massachusetts means, although there's a lot of activity in changing Medigap plans during open enrollment, and frequently around this time, new pricing is set by the plans. You can enroll anytime you want in a Medigap plan. You're not restricted to just open enrollment. Example, if I'm going to have a knee replacement and it's the month of May and my doctor says, hey, maybe you want to do this in June or July. Well, I can pick up a Medigap plan in May and it would be effective for the 1st of June and I would get the benefit from it. So it's not restricted to open enrollment. Plans, these plans don't talk to each other. So if I drop out of one, I have to tell the plan I'm dropping out to terminate. And when I'm going into one, of course, I have to apply and fill out the applications to enter a plan. They do not provide Part D coverage. That's what the prescription drug plans are for here. The prescription drug plans under the option 1, under that path where you're using standalone original Medicare, these are called prescription drug plans or standalone prescription drug plans, also referred to as PDPs. And you would pick one of those up if you want drug coverage, if you're using A and B separately under that option 1 path that was toward the left-hand side of the prior screen. And you can pick up a Medigap also. So now let's take a closer look at Medigaps and what's coming up and what things are likely to happen around 2021. Not a lot of activity here, but so you're aware, Supplement 1 is not available to new retirees. So what does that mean? If you were eligible for Medicare before January 1st, 2020, then you may enroll in Supplement 1 if you wish. If you were eligible after that date, February, March, April, May, June, then you do not have Supplement 1 open to you as an option. You would have to take Supplement 1A. So Supplement 1A is a bit more recent. They are identical plans except for one thing. Again, they are identical except for one thing. Supplement 1 covers something called the Part B deductible. The Part B deductible is an annual deductible you pay for Medicare Part B when you have that coverage. You have to pay the first $198. And again, that figure is for this year, 2020. It's likely to increase for next year, 2021. The rest of these 2 plans are identical. That means they follow the 80-20 rule and they give you coverage. They pick up the 20% of Medicare Part B or even Medicare Part A where coinsurance becomes effective and Medicare pays the other 80%. So they pick up the 20% of Medicare approved charges. And they pick up the deductible also for Medicare Part A when you're admitted as an inpatient to the hospital. That's that $1,408 for this year. Again, next year it may be more. So these are pretty powerful supplements. They cover the deductibles, the coinsurance, the odd copay that may exist under Part A or B, and the 80-20 rules aspect where you pay for 20% of Medicare approved charges. These plans are picking all of that up and you don't have to. They're not free. Check with your Shine Counselor and or the plan directly to get current pricing. The supplement ones run a little over $200 generally. Supplement 1A runs close to $200 per month. And Supplement Core is a little bit different than those two. It runs a little over $100 per month. It does not pick up the deductibles. It does not cover you for the Part A deductible, which is significant, and it does not cover you for the Part B annual deductible, which is less hefty, but it does cover you for the 20% of charges that Medicare normally does not pick up for Medicare approved charges. So it's something that can work with you very good. There are a number of circumstances, depending on your income level, where Supplement Core might be a good choice for you. And again, you can use them with any provider in the United States that accepts Medicare, and these will work. If you want to find the details, again, talk to the plan, talk with your Shine Counselor. MedX Choice is something that's going away. They are not going to be marketing and accepting new people into this thing called MedX Choice. It was kind of a hybrid. And so if you have it now and you like it, you can keep it. And if you don't have it now, you can't get into it. So it's fading away. And what we're seeing is that's basically the major changes around our friends in supplement land, in Medigap land. The new prices for some of the companies are available, but not all. I believe, no, I check with the company to see whose pricing is out, or talk to your Shine Counselor and verify what prices may be and what pricing information they may have. Now we're starting to venture into the Medicare Advantage plan realm. Remember, open enrollment allows you to change your prescription drug plans and your standalone prescription drug plans and your Medicare Advantage plans, and even those that are providing drugs for you. And if you remember in our earlier slide, under option 2, it was the right-hand side, Medicare Part C is a Medicare Advantage plan, and they contract with Medicare to provide an umbrella of charges for, or an umbrella of benefits for you. They provide your Part A coverage, B, and if you want drugs, your drug coverage also. Some characteristics about them: they do contract with Medicare. Medicare approves of them, monitors them, and again, they, for that season, are providing your services. That's what Medicare contracts with them to do. And they are private plans and private companies. So if you pick one of those, it's giving you your hospital and the network of hospitals you can choose from, your providers and doctors and the network you can choose from, as well as your prescription drugs and the network of pharmacies that they deal with. So keep that in mind. And that's where this provider networks bullet over here comes into play. HMOs are health maintenance organizations. They're a strict network. If you're part of that and you go outside, the plan is go outside the network. The plan is not helping you with any of the costs and charges associated with the service you picked up. You're on your own. If it's a PPO, that's a preferred provider organization, as long as the provider is going to interact and join up and participate, you can go to that provider and you'll get some kind of benefit and help from the network. Sometimes it's just as good as if it were an HMO, if it was a strict network. Other times you have to pay more than if you go to one of the more narrowly defined network participants. So it depends. So when you're going out of network and you're in a PPO, then frequently you can pay more, or sometimes you can pay more, and some of them are being defined more liberally in a sense, and you can go out of the network and not get hit with high charges or as high a charge. Check based upon the plan. And something about these plans is the concept of healthy living. They provide extra benefits to you. Things like they might provide dental cleanings and or other plans and programs for dental services. They might provide eyeglasses and an allowance for them, hearing aids, an allowance for that, gyms, etc. These are things that are geared toward your healthy living, and it's a good thing overall. But the red note here is very important. Your overall medical health and costs is what you should be calculating and doing a cost benefit on. If you have chronic conditions and you're going to a lot of physicians and you're getting a lot of tests, a lot of MRIs, CAT scans, all kinds of complicated tests, then there's copays associated with all those. So if that's happening a lot, there's a lot of money that's going into that, and you need to consider, is a Medicare Advantage the best thing for you? And over here, out-of-pocket maximums are the maximum charge you will receive from that plan during the course of a year if you hit that amount of money. And it's really calculated by your Medicare charges, all the copays and deductibles and things of that nature that go toward any approved Medicare service. That's being calculated and added up by your Medicare Advantage plan. When you hit that maximum amount, then you don't pay any more for the rest of that season. A couple points: the copays for your drugs do not go toward that. These are just medical copays that go toward that. Note that distinction. And the other thing, the maximums are all over the place. This year, the lowest maximum is $3,400. The higher end of those can be $10,000. So it depends upon the plan and costs and things. You need to do a little cost benefit analysis for this. This is a general rule next. If you were to pick some plans, there are 4, I believe. Well, there are a number of plans in Massachusetts that charge no monthly premium. Your payment to the plan is all through your copays. So a general rule is that if the premium is lower or zero, the lower the premium, the higher the copays. And that makes sense if you think about it a bit. So if you're a robust, healthy senior and you're not using your plan very much, then one of these plans can be okay for you for that season. And you have to take it season at a time and see if it still fits. And if you're not and you have chronic conditions, then you might want to consider the Medigap plans or a higher premium plan for Medicare Advantage. There are other things we'll see about the Medicare Advantages that can be good or bad. Now, this is just a reiteration that when we were looking at the overview of open enrollment, there were 2 enrollment periods we were discussing. One's the one we're currently in, which is October 15th through December 7th. And then there's another one, which is called Medicare Advantage Open Enrollment, or Medicare Advantage OEP. And that begins on January 1st. And it has a good reason to be there. If you made a mistake of some sort, frequently someone picks a Medicare Advantage plan and they didn't think something through or research something, and maybe doctors they care about aren't in the plan, in which case it's not as helpful as they would like it to be. Another thing that might be there is that the copays, or there might be some benefits that they were anticipating that the plan has and it doesn't have them. So when January rolls around, or February, anytime between January 1st and and March 31st, January 1st to March 31st, if you are in a Medicare Advantage plan, you're already in it at that time, you can do a few things and switch around a bit. And that's what this slide is focusing on. You can pick another plan if you don't like the plan you're in. If you can leave Medicare Advantage and revert back to original Medicare. That's option one. That's that left-hand side of the bifurcation of choices that we were looking at. And if you do that, you are allowed to pick a standalone drug plan or a standalone prescription drug plan. So you can get out of a Medicare Advantage plan during that period between January 1st and March 31st. If you happen to have been in a plan and something odd happened and it's canceled, again, you can take some actions and get a new plan, or you can revert back into original Medicare. What you can't do, and again, talk with your counselor, your SHINE counselor, if you need to follow up on some of these things, is if you're in original Medicare, you can't go into a Medicare Advantage plan. Let me repeat that. You can't do the reverse. This special period, this open enrollment period for Medicare Advantage plan recipients is for them, and they can get out of a Medicare Advantage plan or change a Medicare Advantage plan. But if you're not in one and you're in original Medicare, then you can't enter one of these plans. You cannot do it at that point in time. And that's what this is about. And you also, if you're, again, under option one, original Medicare, and you have a prescription drug plan, a standalone prescription drug plan, you can't change it then. This Medicare Advantage open enrollment has nothing to do with those options and how that's set. But there's always an exception, and that's what the unless is. SEP is a special enrollment period. So if you are, we'll start here, moving out of the area that your Medicare Advantage covers, yeah, then you can, anytime that happens, you can pick a new plan. If you happen to be a member of something called Prescription Advantage, and we'll discuss what that means in a few slides, you can have a one-time change and change your Medicare Advantage plan. If you want to go into a 5-star Medicare Advantage plan, you may do that from outside of the plan that you're in. Or excuse me, you can do that if you're in an outside plan and you want to get in and utilize that. In Massachusetts, we do have one 5-star plan, or I should say company that has 5-star plans. Tufts Medicare Preferred is a 5-star plan, 5-star series of plans. Every Medicare Advantage plan within Tufts Medicare Preferred is a 5-star plan. That means if I'm in any other Medicare Advantage plan in Massachusetts and something was haywire with it and it wasn't what I wanted anymore, I could move into a Tufts Medicare Preferred plan. Also, if I was outside of it, I could, if I was in standalone Medicare, I could go in and enter it. If I was in a particular Tufts Medicare Preferred plan, because there's several of them, I could switch within it also. So it's a nice thing to remember to have that you can consider. Now, other changes, and there's going to be a few that we get involved with in the next few slides for 2021, are listed here, and we'll go a bit beyond that also. In the past, it was restricted and it was narrow on if you had end-stage renal disease, how you could transition into a Medicare Advantage plan. If you want to understand that detail, again, check with your SHINE counselor. But now for 2021, there's a change. And if you have end-stage renal disease or ESRD, and you want to elect a Medicare Advantage plan, you can take one. So this is a change. Whether or not it's a good thing for you, again, case-by-case basis. For some people, maybe it works fine. For others, it maybe not so much. I believe most of the plans, and it's noted that they now take telehealth and support telehealth. And a couple of things to just note on that is your provider, your telehealth experience is going to be as good as your provider's technology and their ability to do that appropriately. So this can vary and things of that nature. But telehealth exists in Medicare for Medicare Advantage plans now. And this thing we will focus on again more closely when we look at drugs in more detail. But there's a model. It's a special program that is geared to last initially for 5 years. And it's a model to provide insulin to people who utilize that. And you can get that through your MA when you have drug plans through your MA, or you can get it through a standalone prescription drug plan if you have gone that route. The thing to note here is that, and we'll get into this again when we get a little further, not all plans are participating, not all drug producers or manufacturers are participating, and it may not be the best fit for all clients, especially in an MADP world where you have the medical end of this to consider as well as the drug end to consider. The other thing here is these have existed, but they're focusing marketing on veterans for Medicare Advantage plans that do not have drug plans combined with them. In Massachusetts, we have 31 Medicare Advantage plans. 26 of them offer drugs, and 5 offer no drugs. So any of those 5 that don't offer drugs, some of those plans might be gearing themselves more toward veterans, because veterans can get their drugs through veteran services if they wish. The other thing, just quickly in reference to this insulin model, and we'll look at it more closely, there are 7 plans out of the 26 plans in Massachusetts, well, not in Massachusetts, in Middlesex County, in our county, that offer this program. So out of the 26 plans in Middlesex County that you can take that offer drugs, 7 of them are participating with this plan and this program. Again, ask for details with your SHINE counselor. Something else to bring to your attention, which you need to be aware about for the upcoming year. This got approved by Medicare prior to this year, but it seems as if there are some plans that may be utilizing this more for this year. And what it is there's a concept of step therapy and prior authorization for drugs. This is not new for prescription drug plans for Part D. This has existed there. And it's now something that the Medicare Advantage plans may get involved in. This is a case-by-case basis, so check your plan to see if it's doing this or not. And what it boils down to is if you're going to get a new treatment and you're going to utilize Part B as in bunny drugs, then they can promote step therapy and say you have to use this drug first before you use this other drug or this other drug. So your physician might have to get involved and might have to request exceptions and push the fact that you need the drug that the physician says you need. And that's similar in reference to prior authorization, the same concept where they want to grant prior authorization for you using a particular Medicare Part B as in bunny drug. And so your physician would have to get involved in this, or may have to if it's not to your best interest to do something like that. So not all of the plans are doing this, but some are. So you want to do your due diligence and see who it fits and who it doesn't. This last thing here is This isn't new. I guess they existed before I was a Shine counselor, and that's quite a while ago. And they're called a Medicare Medical Savings Account. And what they are is, this is described as a consumer-directed plan. Without going through every bullet here and just giving you an overview, some funds are deposited by the company in conjunction with Medicare into an account for you. You can utilize those funds for your medical coverage during the course of the year. You have freedom in doing that, but at the same time, you have responsibility in doing that. If you blow through the money, then you're going to wind up paying out of pocket during a certain phase of this, and it can get quite expensive. So you're taking responsibility to manage your care a bit more with these plans. Also, they don't have strict networks, but that doesn't mean you can go to any doctor you want. They have to be a Medicare provider, and the doctor has to want to deal with this Medicare savings account plan. Just like other Medicare Advantage plans, they can offer extra things. You cannot be a participant of Mass Health, which is Medicaid, or you can't be receiving hospice benefits. And two important things here are, one, they don't give you drugs. So there's no Part D coverage within one of these, which means you are allowed to go out into the list of plans for Massachusetts, which do cover drugs. And those are the prescription drug plans, the PDPs. And there are 27 of them this year. And you can buy one of those if you want. So you could use this plan in conjunction with one of those. And one reason we're focusing on this a bit is when you're in the plan finder, or you're exploring Medicare Advantage plans through any mechanism, these are likely to pop up as a form of a Medicare Advantage plan. And so you need to be aware that it's a slightly different animal. It's not a traditional Medicare Advantage plan. And some more detail on this is there's only one company in Massachusetts that's offering this. And, let's go back. There's only one company in Massachusetts offering this, and that's Lasso Healthcare. And I suggest you go to their website and visit them and talk to a Shine counselor even before you visit them to learn much more about these plans. I'll go down one of these columns to give you an example of how this works more clearly. We've mentioned it before. They have a bank account that gets set up for you in a particular bank, and it gets seeded with $2,000. You aren't putting that $2,000 in. It's being done via the plan and Medicare in some fashion. That's your money to spend on your health care during the course of the year. If you spend more than that, then you start to go up and pay out of pocket. And you'll notice 3,000 here. That's the out-of-pocket maximum if you've gone through the $2,000. So you can blow through the $2,000. You can then pay $3,000 more for services, and that's $5,000, and that's the deductible amount. And then the plan kicks in and starts paying for everything. So you have to manage this stuff. You have to be careful in that sense. There are no monthly premiums. But check into this much further before you just make an assumption that it's good or not good for you. And we'll start to look into drugs and some of the aspects we mentioned about them before in the next slide. In this section, we're going to be looking at prescription drug plans, and focusing on how you might want to analyze and think about drug plans that are available to you. Anything that we see or talk about in this section is applicable to the standalone prescription drug plans and any drug plan you might get through your Medicare Advantage program, the Medicare Advantage plan. The set of rules is the same for both. And there are three areas to consider here. One is cost components. So when you're looking at a drug plan, you know that there's a monthly premium, or usually is a monthly premium. There can be deductibles associated with the plan. These are annual deductibles. And there are a combination of copays that you pay based on drug tiers. A tier is a pricing ladder. In Medicare land, there are up to 6 tiers regarding the costs of drugs. Tier 1 is generally a preferred generic. Tier 2, a generic, maybe not preferred. Tier 3, a brand or a not preferred generic. And these pricings go all the way up to as high as a 6-tier level. And these are different prices that you can pay for the type of drug you're purchasing based upon the type of benefit you get. And the tiers correspond to your copays or co-insurance that you pay at the pharmacy for a drug. So these things taken together, the premiums, deductibles, and the different copays or tier levels that you're paying for your drugs, should be what you're analyzing around as one major aspect of selecting the right drug plan for yourself. The other thing that you need to consider is under other considerations, formularies. Now we have our little set of drugs that we take. For some people, it's very few drugs, very simple, low-cost generic drugs that we take, tier 1 or tier 2 levels. An aside, Massachusetts is a generic mandated state, which means unless your prescription explicitly says that you must take a brand name drug or a specific drug, the pharmacist will fill the drug with a generic that's available. So back to formularies in reference to this, each plan can have a separate formulary and a different formulary. Not all do, but many do. And so, for example, if a company has 3 different drug plans, don't expect that the formularies of what they support for drugs is identical in each plan, in each category. Medicare requires them to have drugs in each category, but it doesn't require them to have all drugs in each category. Another thing to realize is formularies can change during the course of the year. Tiers can change during the course of the year. So these pricing ladder structures, they can change the drugs that you have in them. So your copays might be different as your drug shifts from tier to tier. Restrictions become important. Things like quantity limits. One can identify and see that they make sense in the context of something like opioids. There will be quantity limits on opioids, but sometimes there will be quantity limits on other types of drugs. And so just be aware that that is something that you need to be aware of. Prior authorization and step therapy are things where the company, the drug plan, wants you to try either a lower cost drug first, or they want your physician to interact with them and they want to give prior authorization and permission for you to take a particular drug. These 2 things can require, the authorization and the step therapy can require interaction from your physician, and just be aware of that. And the last thing over here, the third bullet, is preferred pharmacy pricing. 3 comments on that. One is, if you pick a plan and you're going to a pharmacy and it's not in their network, that plan is not helping you in any way, shape, or form. You're not getting any benefit. It's out of network. You're paying full price. The plan's not tracking anything. You're getting no benefit. You don't do that. If the plan's within network, then you're getting benefit from it, and they're tracking the costs toward different levels and thresholds that exist for you, and you're getting the Part D benefit assigned to you, and your copays will be enforced. If it's a preferred pharmacy pricing, then some of these plans contract with and basically put together programs with specific pharmacies where for some drugs, some subset of drugs, you will get a better price at that pharmacy than you would get at another pharmacy using the same plan, same drug plan. If you go to a preferred pharmacy pricing pharmacy, then the copay is generally lower for a certain set of drugs that they've arranged to support. So basically things change. And that's what this is saying over here, this last bullet. During open enrollment, if the set of drugs you're taking is not static and stable and it's changing, if your drug plan's changing, you need to start to go out and contact a Shine counselor or go out to Medicare.gov and do some exploring through the plan finder and see if you can pick a plan that's better for you and more cost effective. Again, cost benefit. Each year, some of these numbers are likely to change. This is called the standard benefit associated with any of the drug plans. Again, this applies to the standalone prescription drug plans as well as the Medicare Advantage drug plans that exist. Same set of rules. These are the current numbers that are in effect for 2020, and they're going up as one would expect for next year, for 2021. The deductible, as you're aware, is an amount of money that you pay off first before the plan's benefit goes into effect for you. An aside thing, not all plans utilize a deductible. Some don't. They have a zero deductible. Some apply the deductible to all drugs, any drug you would take through that plan. So you're paying that $445 or whatever deductible amount they set. You wind up paying for that first before the plan benefit kicks in for you. And some plans have the deductible apply to some subset of drugs. As a general rule, tier 1, the deductible may not apply to any tier 1 drugs you take. Not all plans do this, but some do. So if you're taking a cheap tier 1 generic, you're not paying down, or the deductible just does not apply to that drug. It's just irrelevant for that. But if under that same plan you take a brand name drug, and let's say it's a tier 3 drug, then all of a sudden you're paying a very high price for that, even though your copay states a lower number because you're paying the deductible first. That's all. Again, if you need a detailed description, talk with your Shine counselor and they can go into details for you. This initial coverage limit is tracked by your plan. So when you are taking your drugs and you're paying your copays at the pharmacy, the drug plan you have is tracking your costs. And when you hit a certain level, they will let you know, and all of a sudden your benefit that you're getting, the copay you pay, changes. That's because you're in another coverage phase referred to as the coverage gap. If you read down here, it's also known as the donut hole. And in that coverage gap phase, you pay 25% of the cost of the drug until you get to another stage where you are beyond this number and you've hit the out-of-pocket threshold. They're tracking that for you also. When you hit that level, then again, you're no longer, when you hit that level, the out-of-pocket threshold, you're no longer paying the 25%. You're paying what's referred to as catastrophic cost sharing, and your costs for your drugs drop significantly. So just being aware that there are different phases you pass through when you are getting your drug benefit through the drug plan. And again, these same numbers and rules apply to Medicare Advantage plan drug plans that you might take versus your standalone prescription drug plans. Now, there's a new program, and we touched upon it lightly when we were talking about this existing for Medicare Advantage drug plans also. So if you're in a Medicare Advantage drug plan, this same senior savings plan can apply to you for a select number of plans. So let's look at this more closely now. It's called the Part D Senior Savings Model. Model is the operative word there. It's a 5-year voluntary program that some of the Part D plans participate in, some of the Medicare Advantage drug plans participate in, not all. Some manufacturers participate in this also, not all. So over this 5-year period, the subset of plans that are participating and manufacturers that are participating have agreed to spread your costs evenly over the 3 phases of coverage that you have with a plan. For example, there's the deductible phase. We mentioned that for brand name drugs, tier 3 and above, sometimes tier 2 and above. But when you're in the deductible phase, you're paying down that deductible amount before your benefit materializes and you're utilizing it. And that deductible amount can be as high as $445 in the upcoming year. If you're in this program and you select a plan that participates in this, you'll be paying $35 a month through the deductible phase for your insulin. When you hit the when you hit your initial coverage and you're out of the deductible phase, you'll still be paying $35 a month for your insulin coverage and your insulin drugs that you're taking. When you get beyond it and you hit that phase that I mentioned, which corresponds to the coverage gap or the donut hole, you'll still be paying $35 a month for your coverage. So it flattens things out. Rather than having a high deductible phase, it dropping down during the initial coverage phase and then edging up a lot again during the phase where you're in the coverage gap. It's flattened across the board even. And that can be very beneficial to you. They say that you can save by utilizing this. And they do give estimates of savings if you check into it. And an example to further realize is that you need to check with the plan that's participating just what types of coverage they're giving for insulin. And as an example, there's a particular plan and it covers these types of things. If the plan fits you, it's worth considering. Again, it keeps things flat and stable at $35 a month without the high beginning spike. And even at the initial coverage phase, $35 a month, I'm told, for these products is a good price. And when you finally hit the coverage gap phase, it also tends to be a good price. Not all plans do cover this. I had mentioned earlier that out of the 26 plans that are Medicare Advantage plans that give drug coverage, only 7 are participating in this model. Out of the 27 plans, which are standalone prescription drug plans, standalone PDPs, only 9 of the plans are participating with this. So it may or may not fit you based upon other drugs you're taking. Be aware of it. And eligibility, again, the participation in the plan and the fact that it is a standard cost, but the formulary has to match what you need. If you are on the low income subsidy, which is also known as extra help, you don't qualify for this. And enrollment for this is during the open enrollment period. That's all, just a little reminder. And we're going to get into things like the low-cost subsidy in a moment or two. So changes that are happening to prescription drug plans. There's 2 new plans. One is called Elixir RX Secure. Another one is Silver Script Smart RX. These 2 plans did not exist last year. And they may be of benefit to you. You can check them out. Something to be aware of and cautious of is Envision RX has changed its name to Elixir. And if you were in the Envision RX Plus plan, you got switched to this thing called the Secure plan. It's more expensive. The old plan was $1,420. The new one you're switched to is $3,440. Also, Mutual of Omaha is doing something more strange. The RX Value plan, you're being moved into the RX Plus plan, and that's really quite a hefty difference here. The RX Value plan was $49.30. The other plan is $87.10. So if you are in these situations and you're using these, do contact a Shine counselor and do investigate and see if you can pick a different plan that might fit your needs better. Silver Script now falls under the domain of Aetna. So Aetna is the managing company for the Silver Script plans. There's several of them. And as I just mentioned before, there are 9 plans out of the 27 drug plans available to you in Massachusetts that participate in the Part D Senior Savings Program for insulin. So some cautions. Costs vary, your plan varies, the drugs you take vary and stuff. So make sure that things haven't changed too much, and or if they have, contact Shine, make an appointment, or go out to Medicare.gov and review your drug plans to see if you need to change or not. Now, this is the last phase of things that we'll be discussing in general, but if your plan's expensive and stuff, there are alternatives you might be able to pursue. One is you can ask for an exception if your plan's not covering your drug appropriately anymore. You can ask them to lower costs. Make sure your drug is on formulary, things like that. There are assistance programs we're going to take a look at also in the next couple of slides that could be helpful. And here they are. One is Extra Help. That's a federal program. You can find out a lot about Extra Help, of course, always by contacting your Shine counselor, but you can also go to socialsecurity.gov, and on socialsecurity.gov, they have a lot of information about Extra Help, and you can apply there if you wish. And also Medicare.gov has a lot of information on that also. Prescription Advantage is a pharmaceutical assistance program. It's geared for people who have a lot of high-cost drugs. And if you join the program, when you hit that coverage gap, the donut hole, it will jump in and it will help you. And it can help a lot, a tremendous amount. And call them and see if you are paying a lot, if you can apply and join the program. It has a wide range of coverage options for you in a sense. And other assistance program or Medicare savings plans and programs. We'll take a look at some of these. Everything, or not everything, but many of them are income and asset based. And again, your Shine counselor can help you a lot with them. Digging deeper into Prescription Advantage, if you call them, they'll send you a detail sheet on costs and everything else in an application. If you contact Shine, we will do the same for you. Things to note is if you're 65 and over and on Medicare, your income needs to be below, and I'm talking single here, an individual versus married, but there's married also. It needs to be below $63,800 a year. That's quite a wide range because they're designing this program to help you if you have high drug costs. And something else in reference to it is there's no asset limit. So they're not looking at your bank account and saying you have too much money in the bank, as many of the other programs do. They're just looking to see where your income range is, and they'll let you know where you would fall in and if the plan can be, and the program can be of help for you. And again, it's an assistance program for people that take a lot of drugs. It's not a separate drug plan for Medicare recipients for you. We mentioned there were other plans that are more income and asset dependent. And these plans are referred to, these two, as Medicare savings programs. There's two of them here we're going to be glancing at. And again, your Shine counselor can help you with this. And with one of them, this is just an outline of an income level for an individual or a couple. Now I'll focus on the individual, $1,383 a month. If that's what your income is, then income-wise, you would be eligible for this. But they test assets here, unlike the other program I was talking about, the Prescription Advantage. Here they do look at your assets, and for an individual, it's $15,720. Again, your Shine counselor has information on this stuff in very great detail. Similarly, there's another plan, that one's called the buy-in. This one was called the senior buy-in. And with this, you can have a little higher income level. So if you have $1,755 a month as your income, you can qualify for this. The assets levels are the same. These plans do a couple of things for you. They will help to pay for your Part B premium if you're eligible for them. So that's about $144.60 a month, or whatever the new set rate is, that you won't be paying. So that's quite a nice ease of a burden on you. The other thing is these limits and levels are within a range where if you qualify for these, you qualify for LIS, which is also, it's the low income subsidy for drugs. And it's also known as the Extra Help Program. I mentioned it a few moments ago. So if you qualify for one of these, you qualify for the LIS program also. It's worth checking into. And lastly on this stuff, I'll mention a few things and reiterate this a few times. If you need help with something, on the screen here, you can see that there are a number of agencies out there to do something and to help. Prescription Advantage, I had mentioned, and Prescription Advantage, let's go back. Prescription Advantage can help you if you're in that coverage gap in donut hole. Call them and talk to them. They're helpful and they're very nice and understanding. The pharmaceutical Mass College of Pharmacy, their outreach program, they know a lot about how drugs interact. If you're taking many medications, you can tell them what you're taking and they can tell you if they're blending well or if they want to caution you on something. And they also know a lot about different manufacturers and the assistance programs manufacturers have for high-cost drugs in case you need that and you can't qualify for one of the other programs. Again, with senior Medicare control, if you suspect fraud, call them. They will talk with you and they'll be more than eager to follow up on things. Mass options. If you are looking for assistance in some fashion and it's nothing that would fall under the domain of Shine per se, you can call Mass Options and they should point you in a good direction or the right direction. And lastly, to reiterate a couple of things, I am with the Minuteman Senior Services Shine program. And if you call Minuteman Senior Services and say you want to speak with Shine, they'll connect you up. You may have to leave a message and they may have to call you back because it gets busy. But at the same time, you can actually connect up through there. You can connect up with Shine through your local council on aging. Or again, if you call 1-800-AGE-INFO and press 3, you should be able to get directed to Shine. And you can leave a message there, or if you're lucky, you might even actually get a human being. No, we're very responsive with Shine, and Minuteman Senior Services have been very good and effective with Shine, and we're out here trying to do things to help you. So good luck during open enrollment. If you have questions, do call the agencies I've referenced, and let's see how this open enrollment season goes. Thank you.